Hello friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to talk about chapter number 16, and that is Forensic Toxicology. So toxicology part 1, if we talk about, sir, there are important terms. First, what is toxicology? So toxicology, basically if I tell you about the term toxicology, toxicology is a study related to the poison, their mechanism of action, their clinical sign and symptoms, their fatal dose and their treatment. Because not just knowing the nature of the poison is sufficient, you should know what sign and symptom they can produce, what are the adverse effect can be there, what is the treatment, because you have to save the life also by applying the science forensic toxicology. Also, if someone is dying, you need to, as a forensic medicine expert, you need to check that how that person died, which poisoning was there, and if poisoning is there in the post-mortem technique, which organ need to be opened first? That is your cranial cavity. So these all are the things we are going to study in the toxicology. Every detail we are going to study. So toxicology, what is toxicology? Toxicology is a study of poison in relation to the mechanism of action, how it is acting, what clinical sign and symptoms are there, what is the fatal dose, and what is the treatment, my dear friends. Next term is forensic toxicology. Forensic toxicology is application of toxicology in administration of the justice. When you apply all these things to give justice to someone, for example, person died and you don't know the cause of death. By applying the science, if you figure it out, if you rule it out that what was the cause of death, that will help the person to get the justice. Third thing is ecotoxicology. Third is what? Ecotoxicology. The study of poison in relation to the environment. And father of toxicology is Paracelsus. So if we are studying it relation to the environment, that is ecotoxicology. Who is father of toxicology? Paracelsus. Who is father of modern toxicology? Matthew Orifila. This name Matthew Orifila is important. So classification of poison depends on what, sir? There will be poison, there will be toxin, there will be venom. Three things are there of poison: poison, toxin and venom. What is the difference between three? Let's read the definitions. So if we talk about the poison, any substance in any form, it can be solid, it can be liquid, it can be gas, given through any route, topical injection, it can be, the route can be what, sir? Your IV, route can be oral, intradermal, subcutaneous, sublingual, all routes can be included in this, which causes illness, death, etc. is considered as poison. Any X substance you are giving to the person in any form, and after that there is a sign and symptom which will lead to death of person. Now this X substance will be considered as poison. X substance. If any harmless, where no sign and symptom, then we do not consider this as poison. We do not consider this as poison, my dear friends. Now, next is toxin. Poison is clear. Any substance given in any form through any route which is causing illness or death. Illness can be any type of problem in body, that is illness, disease, or death it can happen, that is poison. Toxin, any substance produced by a living organism. Any substance produced by living organism like bacteria, virus, animal, that is called as toxin. For example, snake is there. Snake is producing a substance which is fatal, my dear friends. This is called as toxin. Now venom, the variety of toxin is called as venom. For example, snake is producing the poison and that variety of poison is called as venom, my dear friends. So 3 definitions are crystal clear to all, my dear friends. What are those? Any substance in any form, solid, liquid, gases, given through any route, topical, injected, cause illness is called as poison. Any substance produced by living organism like bacteria, virus, and anything they are causing, producing, that is called as toxin. That is called as toxicity. And whatever the sign and symptom they are producing, that is called as toxicity. Venom is a variety of toxin. 3 definitions are clear. Now there are total 6 groups, my dear friends. Corrosive poisoners. Corrosive poisoning, they corrodes. Corrosive poisoning, what they will do? They will corrode, my dear friends. Now there will be miscellaneous also, other like agricultural poisons can also be there, sir. Then coming to the cardiac poison, sir. Cardiac poison can be there. Then irritants. Irritant can cause what? Inflammation. What are the 5 signs of inflammation? Rubor, we have all heard, sir, inflammation. Rubor, tumor, dolor, calor, functiolacia. Rubor, tumor, dolor, calor, functiolacia. Rubor means redness. Tumor means swelling. Dolor means pain. Calor means heat. Functiolacia means loss of function. Functiolacia means loss of function, my dear friends. So these are the irritants. Then neurotoxins are there. Then neurotoxic will affect the CNS. Then asphyxiants will be there, mostly the gases. So these are the 6 groups of poisons we are going to study, sir. Corrosive, miscellaneous, cardiac, irritant, neurotoxic, and the asphyxiants, my dear friends. Now what are the laws which are related to the toxicity? If we talk about the laws related to the toxicity, my dear friends. So laws related to the toxicity is like this. First IPC you need to remember right here is 326. It is related to the vitriolage. 326 is related to the vitriolage, my dear friends. So 326 is grievous hurt. With dangerous weapon. Dangerous weapon. 326 is divided into A and B. A for acid attack. B for acid attacked attempt, my dear friends. Acid attacked attempt, my dear friends. So 326 related to the vitriolage, which is grievous hurt with a dangerous weapon. 326A is attack and B is there is an attempt, my dear friends. There is an attempt, my dear friends. Now coming to 357 CRPCs. 357, no acid attack. Victim will be denied treatment by any hospital. No acid attack victim. The victim who got the acid attack should not be denied by any of the hospital, whether it is private hospital, whether this is government hospital. No hospital can deny the victim. They have to treat. If they deny, they will be punishable. And this comes under 357 CRPC, Criminal Procedure Code. Then coming 166B. 166B, punishment for delayed or denied treatment to the acid attack victim. Delayed or denial, this is punishment. Under 357 CRPC, it says no hospital should deny. And if they deny, they are punishable under delay or deny. Delay and deny both, they are punishable on 166B IPC, my dear friends. Indian Penal Code. Now coming to 154 CRPC. 154, the police is bound to file the FIR if the woman is there in the society and the girl belong to some kind of, in the villages etc., there is like lower caste, high caste. Very lower caste Dalit, or you say Dalit girl went to the police, and police can't say no to anyone, irrespective of their religion, irrespective of their caste, socio-economic background. They are bound to file the FIR, my dear friends. They have to file FIR under 154 CRPC. Under 154 CRPC. Now next is 166A. Punishment to police for not filing the FIR. They have to file, that is defined by 154 CRPC. But if police person denied, the duty in charge denies to file the FIR, then that person is punishable under 166A IPC. Now 39 CRPC. 39 CRPC says every medico-legal case should be informed to police and magistrate. Every medico-legal case. Every MLC which is happening in the hospital. MLC cases can be like acid attack, like rape, like assault, dowry death. These are some examples of the medico-legal cases. In such cases, the police and the magistrate needed. Police, primary police you need to inform. As a doctor, police will inform the magistrate. Then 175 CRPC. 175 CRPC, the victim is bound to give all information to investigating officer. An investigating officer should not reveal, investigating officer plus doctor should not reveal the personal information of the victim. Victim should say everything true, but the doctor and the investigating officer should not reveal her name, identity, etc. If they do so, they are punishable. It's a crime, my dear friends. So what all important laws related to toxicology you need to learn right now, sir? First of all, we talk about 326 IPC. 326 IPC is related to the vitriolage. 326A, 326B. If we talk about the 326A, that is acid attack. 326B is acid attack attempt. Then coming to 357 CRPC, no acid attack victim will be denied treatment by any hospital. And if they do so, they are punishable under 166B IPC. Then 154. Police is bound to file FIR. If police denies to file the FIR, then they are also punishable for not filing the FIR under 166A. Then 39 CRPC. Every medical legal case which is coming to your hospital, you should inform police magistrate. Then 175 CRPC. Victim is bound to give all information to the investigating officer. But the investigating officer plus doctor has to keep that confidential, my dear friends. Done? Now coming to the treatment regime. If we talk about the treatment regime, my dear friends, first we'll give the activated charcoal. Activated charcoal is nothing but a physical antidote. It is an antidote for many poisoning cases. What is the mechanism of action? See, it's a physical antidote. Mechanism of action, for example, this is charcoal. The poison will get attached onto the surface of the charcoal and then it will be removed out from the body. Then it is removed out from the body. My dear friends. How much dose? 1 gram per kg. If let's suppose 80 kg person is there, then you have to use the 80 gram of charcoal. So activated charcoal, my dear friends. Universal antidote, activated charcoal. Then titanic acid, magnesium oxide, my dear friends. So this is universal antidote in which we use all three. How we are using ratio? 2:1:1. Ratio is 2:1:1. Activated charcoal is used more, 2:1:1. Now sir, there are some contraindications of charcoal. You can write right here sir along with me. There are the contraindications of charcoal. In which poisoning you don't have to give the charcoal. Contraindication of charcoal. Contraindication of charcoal, if we see sir, right here sir, cyanide. After cyanide we are having ethanol. After ethanol we are having sir methanol. Corrosives, hydrocarbon, then lithium. So these are some contraindication of charcoal. What we have sir? Cyanide, ethanol, methanol, corrosive, hydrocarbon and lithium. These are the contraindication. And what is universal antidote? We use ATM. The mnemonic is ATM. ATM we use in the universal antidote. First is activated charcoal, ratio is 2. Then there will be tannic acid, that is ratio 1. Then there will be a magnesium oxide, okay, ratio 2:1:1. This is how beautifully we are learning this thing. Now coming to the next. Treatment in comatose. Activated charcoal. Comatose patient is there. So coma cocktail we do sir. Comatose patient is there. Coma cocktail will go in coma cocktail. What we are using sir? DNV. What we use sir? DNV we are using. Treatment in comatose patient. Just cut this. Comatose patient means, what do you mean by comatose patient? That means patient is unconscious. Patient is unconscious. So coma cocktail we give to that. That is dextrose. D for dextrose. How much dextrose we have to give, my dear friends? 100 ml of dextrose will give. Then second will give naloxone. Naloxone 2 mg will give sir. Naloxone, one is naltrexone. Trexone is given orally. Naloxone is given IV route. Then vitamin B1 we give 100 mg, my dear friends. This is DNV. DNV. D for dextrose, naloxone and vitamin B1 we give here sir. Okay. Now there will be another regime for comatose patient, that is Scandinavian regime. Scandinavian regime, my dear friends, remember A, B, C, D, E. A very simple Scandinavian regime, my dear friends. Scandinavian regime, you remember A for airway. You will secure the airway first. Then there will be a breathing. You will check whether the person is breathing or not. Airway you have to check. Breathing, airway, breathing. Then circulation. You will check heart is pumping or not. Vitals are coming. Then we will give the drug. Then we will evaluate. That is follow up. That is follow up. So first is airway. You will check whether you will intubate the patient if needed. Then breathing you can give with the help of ventilator, or you can give with the help of ambu bag, etc. Then circulation you will check with the help of pulse plus heart rate you can check. Then drugs you can give. Then you can evaluate the patient. So this is a primary thing you are doing to a person. Now sir, gastric lavage we need to do. Gastric lavage, if you see, the stomach wash is indicated 3 hours of the ingestion. You are sitting working in emergency department and patient is coming to you, Dr. Saab, poison history is 2 hours late, 2.5 hours late, 1 hour late. Then you can do. If they is saying, Dr. Saab, it is more than 3 hours, then you don't have to do the gastric lavage. It is not indicated. The tube which we are using right here, sir, that is called as evolved tube. The tube which we are using right here, sir, that is called as evolved tube. Evolved tube is 150 centimeter long. You can very well see right here, sir. This tube, this blue color tube is evolved tube. Evolved tube. This tube is 150 centimeter long. Potassium permanganate is used. Concentration is 1:5,000 with the normal saline. So evolved tube is used, and my dear friends, how to do this? See, you are putting some potassium permanganate from here, and after putting here it will go inside the GIT. After going here you will see the level will increase. After level will increase, you will drop down like this. Once you drop down like this, all of the water, this potassium permanganate will come outside along with the content which is there. This is how the gastric lavage is done, my dear friends. Gastric lavage is done. How to do? First we take a steps. We take a evolved tube. Evolved tube. We collect sample. We collect the sample, then we use the liquid what we are using, the potassium permanganate. One is to 5,000 concentration. Other material can also be used. Then you are filling abdomen, or you can say stomach. Then throwing out. This is how it is done, my dear friends. Now other materials which would be used, my dear friends. Other material which would be used would be sodium bicarbonate. Tannic acid for precipitation we can use. Sodium iodide and calcium we can use, sir. Sodium iodide and calcium we can use, sir. So sodium bicarbonate, tannic acid is sodium iodide and calcium. This we can use as, sir, other product. As, sir, other material use would be. Now, sir, there will be some contraindication of gastric lavage. Now, sir, there is a contraindication of the gastric lavage. For example, esophageal varices. What do you mean by esophageal varices? In esophageal varices, there will be a portal hypertension. Portal hypertension will lead to what? If this is esophagus, the veins which are in the esophagus will be more tortuous, and they will be looking like this. They will be more tortuous like this. If we do the gastric lavage, there is a high chances that tube can damage these vessels and there will be bleeding. And now your patient will die. Will die because of the hypovolemic shock. That is why it is contraindicated. Second thing is pregnancy. We should also not do gastric lavage in the pregnancy, my dear friends. Then convulsions are there. Convulsion is what? If person is in seizure, that means there will be a electrical, in convulsion there will be seizure plus motor activity, electrical plus motor. Electrical plus motor activity is present if the patient is in seizure, doing this, that time you should not give the gastric lavage. Why you should not give gastric lavage? There is a high chances while putting the tube. You can damage the internal organs. You can damage the internal organs, my dear friends. Now, corrosives also are contraindicated. Exception is there. That exception is carbolic acid. That exception is what, sir? Carbolic acid. So, what we learned right here, sir? Contraindication of gastric lavage is esophageal varices. First, why varices are happening? Because increase in the portal hypertension. Second thing is pregnancy. Pregnancy also increase, pregnancy induced hypertension is there. So we'll avoid giving the lavage, etc. It can rupture the vessels. Convulsant if it's there. The convulsion word means there is electrical and the motor activity is increased. In that patient also, if any drug also that person is taken, anticonvulsant drug also is taken, there is a high chances that again seizure can come. Corrosives except the carbolic acid. Corrosives except the carbolic acid. If patient is in comatose position, patient is like lying down like this, unconscious, then also we avoid doing the gastric lavage. We avoid doing the gastric lavage, my dear friends. Now, specific antidotes, if we talk about, sir, specific antidotes, we have a long list of specific antidote we'll be learning right now, sir. First, I'll just take this space to write it down. So, specific antidote, if we talk about, sir, carbon monoxide, the antidote of carbon monoxide will be high flow oxygen, high flow O2. Second, if we talk about the beta blocker, toxicity is there, beta blocker. If beta blocker is there, sir, then your treatment is glucagon. Then, sir, third one is cocaine. If cocaine is there, then antidote is amyl nitrate. Also, this amyl nitrate is used in cyanide. Same we use amyl nitrate. Then next is what, sir? Next is your arsenic. In arsenic, sir, it will be your ball. Also, you can use DMSA. So, next would be your copper. In copper poisoning, your antidote will be penicillamine. Then, sir, coming to the iron. Your antidote will be desferoxamine. Then coming to the lead, it will be EDTA. Then coming to the mercury, the antidote would be DMSA. Or ball is also used, my dear friends. So these are some important antidotes we need to remember, my dear friends. So these are the antidotes. Some antidotes we have summarized at one place. What are those? Carbon monoxide poisoning, if it is there, sir, then there is a high flow oxygen. If there is beta blocker, there is a glucagon. And if there is a cocaine and cyanide, amyl nitrate we give, sir. Then coming arsenic, there will be ball or DMSA. Then coming to the copper, in copper there is penicillamine, and iron there is desferoxamine. And lead it is EDTA, mercury, DMSA. Now, there are the drug called as diuresis. Drug, my dear friends. So, drug called as diuresis, if we talk about, sir. So, first is acidic diuresis. Acidic diuresis, there will be ACQ. The mnemonic is what, sir? ACQ. Amphetamine, cocaine, quinine. Amphetamine, cocaine and quinine, my dear friends. Then coming to the alkaline diuresis. If we talk about PSM. Alkaline diuresis. If alkaline toxicity is there, alkaline levels are more, then alkaline diuresis we do with the help of phenobarbital, sulfonamide, methotrexate, my dear friends. So if acidic diuresis, if more acidic nature is there, pH is more acidic, then we need to give the drugs called as ACQ. If acidic is more, acid is like a heat is more, we switch on the AC. This is how you need to remember. Acidic, it is ACQ, amphetamine, cocaine, quinine, amphetamine, cocaine, quinine, and alkaline diuresis, there will be phenobarbital, sulfonamide, methotrexate. Phenobarbital, sulfonamide, methotrexate. Now we talk about next procedure. What we can do is hemodialysis. Hemodialysis, it is contraindicated in KBC heroin. Hemodialysis, what we do in hemodialysis, sir, now what is happening, your toxin, like X toxin, will go into GI. From GI it can go to blood. If the time is more, it is directly proportional to the time. More time, more area it will cover. So now it is reaching the blood. From blood we have to remove it. For that we do hemodialysis. Hemodialysis we do, we give the blood, and that blood we remove and we give the fresh blood, my dear friends. Now this is contraindicated in KBC heroin. The mnemonic is KBC heroin. What is KBC heroin stands for? K for kerosene. K for kerosene. Kerosene also you don't have to do the hemolysis, and also gastric lavage is contraindicated in the kerosene, my dear friends. Second is B for benzodiazepines. If benzodiazepine toxicity is there, you don't have to do the hemodialysis. Third is copper sulfate and chloroquine. Chloroquine, anti-malarian drug, chloroquine toxicity is there, copper sulfate toxicity is there. You don't have to do the hemodialysis. Then last is heroin. So KBC heroin, along with me, K for kerosene, B for benzodiazepines, C for copper sulfate, chloroquine, and H for heroin, my dear friends. So this is all you need to know here. Then the hemodialysis. So this is how we started everything. First we have learned about the charcoal. If after charcoal there is a coma, in comatose patient, we give the coma cocktail, scavenger regime is there, then gastric lavage is there. After gastric lavage there will be diuresis, and antidotes we can give, diuresis also there, acidic diuresis, then alkaline diuresis, then in the last we can do what's a hemodialysis. Also we can go for hemodialysis. Everything has their indication and the contraindication, Now we'll move on to the postmortem finding in the poison, my dear friends. Postmortem finding in the poison, if we talk about the postmortem staining or the liver motis. Postmortem staining or the liver motis, what all colors you will get according to the poisoning. If someone died because of carbon monoxide poisoning, what color of postmortem staining or liver motis? Cherry red. Sir, what is this liver motis? Liver motis is staining and seen on dependent parts of the body. Dependent parts of the body which are not touching the wall. Dependent parts are the parts which are not touching ground. And if body is present in water, then liver motis is absent. Liver motis is absent, my dear friends. Now, if also one more condition you need to add here. If you change position of body within 7 hours, then also liver motis is absent. Okay. Now, what are the colors you need to remember right here, sir? If we talk about the postmortem staining or liver motis, cherry red, there will be carbon monoxide. If brick red color is there, the cause of death is cyanide poisoning, my dear friends. And blue green is a hydrogen sulfide poisoning. Chocolate brown, alanine poisoning. Black, it is opium. There will be alanine, alanine you will see, benzene, alanine, benzene and nitrate. In all three you will get a chocolate brown color. And plus one more, hypothermia. You will see pink color, livor mortis. Pink color, livor mortis you are going to see, my dear friends. Now let's talk about the next thing. First we'll revise this post-mortem staining or livor mortis. Cherry red, carbon monoxide. Bricked red, cyanide. Blue green, hydrogen sulfide poisoning. Chocolate brown, alanine poisoning. Black, it is opium poisoning, my dear friends. Plus benzene, alanine, nitrate, that will be chocolate brown. And if someone is dying because of the hypothermia, then your answer would be pinkish color would be there. Now in the poisoning cases, the cavity opened first would be the cranial cavity. The cavity which we are opening first would be the cranial cavity, my dear friends. Now cranial cavity, there will be a smell after opening the cranial cavity. Moment you open the cranial cavity, there will be a smell, and with this smell you can identify the type of poison the person had before dying, my dear friends. So this is a medico-legal importance of the forensic medicine here. So shoe polish smell, if it is coming, what smell, sir? Shoe polish smell. That means nitrobenzene toxicity was there. The poisoning happened because of your nitrobenzene. Carrot like smell, if it is coming, my dear friends, carrot like smell, then there will be a hemlock. So shoe polish, there will be a shoe polish, nitrobenzene. And if we talk about the carrot like smell, then it is hemlock. Then sir, burnt rope smell. Burnt rope like smell is of cannabis. Favorite, cannabis. Now fish like smell is of zinc phosphate, fish like smell. Fruit like smell is because the person died because of the ethanol, my dear friends, ethanol. Fruit like smell will be coming. Not if fruit like smell is coming, never ever think that person died because of eating lots of fruit. That is not going to be the scenario. Then bitter almond smell is because of the cyanide. Bitter almond smell is coming because of cyanide. And rotten egg is because of hydrogen sulfide. Now again, sir, shoe polish smell, nitrobenzene is there. Carrot like smell, hemlock. Burnt rope like smell, cannabis. Fish like smell, zinc phosphate. Fruit like smell, ethanol. Bitter almond smell, cyanide. Rotten egg smell, hydrogen sulfide would be there. And if kerosene like smell is coming, then organophosphate poisoning would be there. If carrot like smell is coming, there will be organophosphate poisoning, my dear friends. And if garlic smell is there, there will be a cap. The garlic wears cap. Now you will ask me, sir, when the garlic started wearing cap? If this is a garlic, you will see there is a cap. Okay, there is a cap. Okay, so C for sulfos, arsenic, phosphorus, sulfos, arsenic, phosphorus, sulfos, arsenic, phosphorus, sulfos, arsenic and phosphorus, my dear friends. They will have which smell, sir? They will have the garlicky smell. They will have what, sir? Garlicky smell. Sir, color of stomach mucosa. From the color of stomach mucosa also, you can come to know that which poison the person has taken. So if we talk about the color of stomach mucosa, first of all, grey color if we talk about, if grey color mucosa is seen, then phosphorus toxicity will be there. If grey color mucosa is there, phosphorus toxicity. If white color is there, then carbolic acid. White color, carbolic acid. Blue green, there will be a copper. Blue green, copper will be there. Green, there will be a ferrous sulfate. Green, there will be what, sir? Ferrous sulfate. Then coming to the yellow, yellow is nitric acid and black is sulfuric acid. Black is sulfuric acid. Let's learn them. Gray is phosphorus, white is carbolic acid, blue green is copper, green is ferrous sulfate, yellow is nitric oxide and black is sulfuric acid. So these are the colors of the stomach mucosa. When we dissect it, you will see there will be a color changes like this. Now we coming to the teeth. From the teeth also we can come to know the mode of poisoning. So first of all, chalky white teeth, if we talk about chalky white teeth, there will be a sulfuric acid poison. Sulfuric acid. If black tongue is there and black teeth is there, then cocaine is there. Black tongue and teeth is there, then cocaine toxicity would be there according to the teeth, my dear friends. Now pattern of mucosa. If we talk the pattern of mucosa, leathery mucosa will be seen in the carbolic acid mucosa inside, and red velvety mucosa is seen in the arsenic, my dear friends. So leathery mucosa, carbolic acid, and if red velvety mucosa is there, arsenic would be there. Arsenic toxicity would be the cause. Subendocardial hemorrhage. The subendocardial hemorrhage is happening because of the arsenic poisoning. Subendocardial hemorrhage is happening because of the arsenic poisoning. Then delayed decomposition is seen in the decomposition. You remember air, water, then soil. In air it will take 1 week. This is called as Casper dictum. 1 week, water 2 week, and soil it will take 8 week. Soil it will take 8 weeks. So what is there, sir? Delayed decomposition is seen in cyanide, metal poison and strychnine. CMS, combined medical services. The mnemonic you have to remember, combined medical. The delayed decomposition is seen in cyanide, carbolic acid, metallic poison and strychnine. Strychnine mimics which poisoning? Strychnine mimics tetanus. And arsenic mimic cholera. Arsen mimics the cholera. Now postmortem examination of poisoning. Postmortem examination, the sample and the preservative we need to learn right here, sir. What sample is there, what preservative we are using. If we talk about the sample right here, sir, sample 100 ml of blood need to be preserved in the sodium fluoride. If we need to preserve the blood, then sodium fluoride is a preservative we can use. 100 ml of urine, thiamol is better answer than the toluene. Thiamol is better answer than the toluene. So blood it is sodium fluoride, urine it is thiamol is better answer than toluene. Now coming to the another samples also, sir. Visceral organs like stomach. What do you mean by visceral organs? Hollow, viscous organs. Hollow viscous organs. The visceral organs like stomach, liver, intestine, etc. Best is rectified spirit. The best we can use what with, sir? Rectified spirit. But most common would be saturation of the common salt. Common salt we use most commonly, but the best is rectified spirit to keep the visceral organs like stomach, liver, etc. intestine. For the histopath examination, we use the formalin. You guys have seen many things in your college life also. You will see there the for the histopath examination, we keep the formalin. For the virology of the organism, we use the glycerol. If we study the virology of the that particular thing, organism, we need to keep that in the glycerol. Now, the poison and the specific organ preserving. This table is very, very important. In which poison, which organ need to be preserved. If there is a OP, organophosphate poisoning, brain need to be preserved. If it is organophosphate poisoning, which specific organ need to be preserved, my dear friends? Brain need to be preserved. If it is gaseous, then lungs needs to be preserved. because gases will eventually come into lungs only. If heavy metal is there, where it will settle? It will settle in the bone. What will happen from GIT? GIT to the blood circulation. From blood circulation, it will be absorbed in the bone, like diatoms, heavy metals. Adrenaline, subcutaneous fat you need to preserve in case of adrenaline poisoning. Then coming to the glutathione, nicotine, barbiturate, then methadone, then cocaine. In all those, Bombay Medical College, good night. The mnemonic is there, Bombay Medical College, good night, good night. So remember, gallbladder and bile both, because in gallbladder only you will see the storage of bile. Now coming to question, the best organ for DNA extraction of a dead body, the best organ for the DNA extraction of the dead body would be the spleen. Would be what's the spleen, and best organ for DNA extraction in the decomposed body would be the brain. The body is decomposed, body was buried somewhere, body was decomposed, and now you need to check the DNA, then you will use the brain. And if there is a dead body on your autopsy table, fresh autopsy you are performing, then the best would be what's your spleen. Thank you so much.